Dear learners, you are welcome in this session number 7, which is on nursing care of a patient with leukemia. Nursing care of a patient with leukemia, and through this session we'll be guided by the following related tasks, that is, define the leukemia, identify the risky factors of leukemia, explain the pathophysiology of leukemia, identify signs and symptoms of a patient with leukemia, explain the type of leukemia, identify diagnostic measures of leukemia, identify the treatment modalities that can be given to a patient with leukemia, explain the nursing management of a patient with leukemia. By definition, leukemia is a cancer of the body's blood-forming tissue, including the bone marrow and the lymphatic system. It is characterized by abnormal proliferations and the maturation of the lymphocytes. This type it occurs when immature leukocytes develop into leukemic cells that multiply profusely, causing the bone marrow production of all cells to decrease, that is pancytopenia. Leukemia, it is a general term. It's used to describe a group of malignant disorders that affecting the blood and the blood-forming tissues of the bone marrow, the lymph system, and the spleen. Leukemia usually affects the white blood cells. It is literally a white blood cells is a neoplastic proliferation of one particular cell type, either granulocytes, monocytes, lymphocytes, or megarocytes. It occurs in all age group. It is not selective. Watoto wanaweza kupata, watu wazima wanaweza kupata. It results in an accumulation of dysfunctional cells. Kwa nini? Kwa sababu it loses of irregulation in cell division. It has no regularity. It follows a progressive course that is eventually fatal if untreated in the early stage. The causes and the risky factors. Remember, dear learners, the cause is not known, but there are risk factors for the development of leukemia. The causes of leukemia is not fully known, and most of the leukemias result from a combination of the risk factors. Moja ni genetic and immunological factors. For example, a person with Down syndrome are more likely to develop leukemias. Another is viral pathogenesis, viral infection. Another factor is bone marrow damage. And the bone marrows can be damaged through radiation exposure or from a chemical such as benzene and the alkylating agents. The authorities point to exposure to radiation in part because of radiologists have been found to have a higher than average development of the leukemias. Some patients have developed leukemias after being treated for another unrelated malignancies using radiation therapy or chemotherapy. Alikuwa na cancer sehemu nyingine, lakini akawa treated na radiation au na chemotherapy. Then hizo bone marrows na blood forming tissues zina damage. Researchers have noted the higher occurrence rate in persons who lived through the Hiroshima and Nagasaki atomic bombing during World War II. Water polluted with benzines and other chemicals may be also the factors contributing to the development of leukemia. We have types of leukemia. Leukemia can be classified based on acute versus chronic, and on the type of white blood cell involved, which type of blood cells have been attacked. The term acute and chronic refers to cell maturity and nature of the disease onset. Abrupt onset or a progressive onset of the leukemia. Acute leukemia is characterized by the proliferation of immature hematopoietic cells, where in leukemia develop after malignant transformation. Hematopoietic cells followed by a cellular replication and expansion of that malignant clone. This is the process of producing genetically identical cells, the same cells. Symptoms of the acute leukemia begins very suddenly. It is abrupt in onset, and the patient is very sick. Usually, the death occurs within a week to months without aggressive treatment. Chronic leukemias, it involves more mature form of the white blood cells, and the disease onset is more gradual. It develops slowly, and the patient can be surprised. The patient can be surprised by the diagnosis because they don't feel any signs and symptoms. They feel well, they are okay. The disease trajectory can extend for years and years. And the symptoms evolve over a period of months to years, and the majority of the white blood cells produced are matured. Leukemia can also be classified by identifying the type of leukocytes involved, whether it is of myelogenous or lymphatic origin. Lymphoid leukemias affect the lymphocytes. Myeloid leukemias, it originates in the stem cell of the bone marrows, stem cells of the bone marrows that develop into monocytes, granulocytes, erythrocytes, and platelets. By combining the acute and the chronic categories with the cell type involved, one can identify 4 major types of leukemias. Ni zipi hizi? Ya kwanza ni acute lymphocytic leukemias, ALL, acute lymphocytic leukemias. Naomba hizi abbreviation tuzishike vizuri, baadaye tunavyoendelea tutaendelea kuzitumia. ALL, this is acute lymphocytic leukemia. Ya pili ni acute myelogenous leukemias, AML. Ya tatu ni chronic myelogenous leukemia, CML. Fourth one, chronic lymphocytic leukemia, CLL. In acute myelogenous leukemia, these types makes up approximately 80% of the acute leukemias in adults. It affects a person older than age of 20. Its onset is often abrupt and dramatic. Lakini the patient might have a serious infection, abnormal bleeding, because the clotting factors imekuwa interfered, kinga ya mwili imeshuka, kwa hiyo anapata infection kwa rahisi zaidi. AML is characterized by uncontrolled proliferation of myeloblasts. These are the precursors of the granulocytes. What will happen is hyperplasia of the bone marrow. The clinical manifestations are usually related to replacement of normal hematopoietic cells in the bone marrow by leukemic myeloblasts, and to lesser extent to infiltration of other organs and other tissues. Acute lymphocytic leukemia. This is the most common type of leukemia in children, and it accounts for about 20% of acute leukemia cases in adults. In ALL, immature small lymphocytes proliferate in the bone marrow. Most are of B cells origin. The majority of the patients have fever at the time of diagnosis. Signs of the symptoms may appear abruptly with bleeding or fever, or they may be insidious with progressive weaknesses, fatigue, bone or joint pain, and bleeding tendencies. But when the central nervous systems are involved, then huyu mgonjwa ataanza kupresent signs and symptoms of meningeal irritation. Tunasema ni leukemic meningitis, which caused by arachnoid infiltration. Chronic myelogenous leukemia. This is caused by excessive development of mature neoplastic granulocytes in the bone marrow. The excessive neoplastic granulocytes move into the peripheral blood in a massive number and ultimately infiltrate the liver and the spleen. Napata sasa hepatomegaly and splenomegaly. The natural history of CML is a chronic stable phase, which is followed by the development of more acute aggressive phase. Is referred to as a blastic phase. Blastic phase. The chronic phase of CML can last for several years and can usually be well controlled with the treatment. Kianza matibabu mapema inaweza kuwa controlled vizuri. But even with the treatment, the chronic phase of the disease eventually progress to the accelerated phase, ending in a blastic phase. Once now the CML transform to an acute or blastic phase, it needs to be treated more aggressively. Ikimove kwenye aggressive phase, hapo sasa tunahitaji aggressive treatment pia, similar to acute leukemia. The chronic lymphatic leukemia is the most common leukemia in adult. It is characterized by the production and accumulation of functionally inactive but long-lived, small, mature-appearing lymphocytes. These cells are usually involved. The lymphocytes infiltrate the bone marrow, infiltrate the spleen, infiltrate the liver. Lakini pia kuna kuweko na lymph node enlargement, tunaita lymphadenopathy. It present throughout the body. Complications are very rare in early stage, but might develop as the disease advances. Pressure on the nerves from enlarged lymph node might cause pain, even paralysis. Mediastinal node enlargement leads to a pulmonary symptoms, because usually the disease of all the other treatments decision must be made by considering the progression of the disease and the side effect of the treatment. Consider the progression, in which stage the disease is, and the side effect of the treatment. Najua kwamba kumpa radiation kwenye old age wanashindwa kutolerate radiation au some of the chemotherapy side effects. And also many individuals in the early stage of CLL require no treatment, and the others might be followed closely and receive the treatment only when the disease progresses. The pathophysiology of leukemia. In general, leukemia is thought to occur when some blood cells acquire mutation in their DNA. They also relate to problem caused by bone marrow failure and the formation of leukemic infiltrates. A bone marrow failure results from bone marrow overcrowding by abnormal cells and inadequate production of the normal marrow's elements. The patient is predisposed to anemia, thrombocytopenia, and decreased number and function of white blood cells. As leukemia progresses, fewer normal blood cells are produced because the area is crowded. The abnormal white blood cells continue to accumulate. Why? Because they do not go through the normal life style to death. Cell life cycle haifikii mwisho, kwa sababu na hii medically tunaiita apoptosis. The leukemic cell might infiltrate the patient organs, leading to problems such as splenomegaly, hepatomegaly, lymphadenopathy, which occurs as the lymphocytes are trapped with the lymph nodes. Mgonjwa anapata bone pain, meningeal irritation, and the oral lesions. Lakini pia kutakuweko na solid masses from collection of the leukemic cells called chloromas. A high leukemic white count in peripheral blood can cause the blood to thicken and potentially can block the circulatory pathway. Blockage of the circulatory pathways tunaita leukostasis, and it can be life threatening ikifikia stage kama hii. Hapa tunaona summary ya pathophysiology ya leukemia. Ukiangalia vizuri juu kabisa hapa imeanza na leukemia, ambapo there is a proliferation of immature white blood cells forming malignant and blast cells. Asa itakuja kwa njia mbili. Njia ya kwanza itashuka kwenye bone marrow failure, resulting into bone marrow failure. Blood cell replaces the bone marrow Sasa huku ikifail kunatokea erythrocytes kwa damage. Erythrocytes zikiwa damage, inakuja kitakachotokea ni anemia. Kwa hiyo huyu mgonjwa inawezekana kitakachomleta sasa hospitali ni sign and symptoms of anemia. Sasa sign hizo ni zipi? Moja ni weaknesses and pallor. Lakini through bone marrow failure, ikija kwenye lymphocytes, huyu mgonjwa anapata immunosuppression, immunity yake inashuka. Sasa immunity ya huyu mgonjwa wetu ikishuka, atakachokutana nacho ni infection, prone to infection. Sasa akipata infection, dalili zake ni zipi? Dalili yake moja ni fever. Kwenye bone marrow failure, ikija kwenye platelets zikiwa zimeharibiwa, sasa ile clotting factors, mgonjwa anapata bleeding kwa sababu there is a decreased clotting factor. Mgonjwa huyu sasa ata end up with thrombocytopenia. Sasa dalili la thrombocytopenia ni zipi? Moja ni pathesias, easily bruising and purpura. Hii ni side ya bone marrow failure. Ikija side nyingine ya cell infiltrate sites outside the bone marrows, na most common sites ni central nervous system involvement and testicles. Inakuja tena sehemu nyingine, other sites of involvement, yani it has moved from its original site. Inakuja ku attack lymph nodes, it attacks the liver, attacking the spleen, attacking the joint. Kote huku sasa unapata lymphadenopathy. Kwenye liver unapata spleen, hepatomegaly. Kwenye spleen unapata splenomegaly, na huku kwenye joint unapata joint pain. Hii ni summary tu ya pathophysiology ya leukemia. Sasa baada ya hapo, kitakachotokea ni mgonjwa anaanza kupresent signs and symptoms of leukemia. The signs and symptoms depend on the type of leukemia. Kama tulivyoona kwenye hiyo diagram hapo juu, kwamba high fever inakuwepo, abnormal bleeding, fatigue, night sweats and anemia. Splenomegaly, headache, bruising or bleeding easily, bone and joint pain, swollen lymph nodes in the armpit, neck or in the groin, loss of appetite, na frequent infections, losing weight, teeny red spots in the skin, petechiae. Basi hili ni summary tu ya hayo tuliyosoma. Utajaribu kuyapitia mwenyewe, they are self-explanatory. Allow me to jump to another slide of diagnostic measures of a patient with leukemia. Kitu cha kwanza kabisa tutakachofanya kwenye diagnostic, moja ni physical examination. And then nyingine ni blood test, perform a full blood picture, and this might shows a decrease in the number of platelets, decrease in number of red blood cells and the mature white blood cells. Pia tutafanya lumbar puncture. Hii inatusaidia nini? To determine if the central nervous system has been involved. Lakini si hatuishia hapo, pia tunaweza tukafanya bone marrow biopsy, obtaining the biopsy, the tissue from the bone marrows. to differentiate between myeloid and lymphoid involvement. Also, we can perform genetic analysis of the peripheral blood and the bone marrow components, which might show the presence of the Philadelphia chromosome in patients with CML. Hizo ni diagnostic chache ambazo tunaweza tukaperform kwa wagonjwa hawa wenye leukemia, regardless of the type kama tulivyoona. Now let's look on the treatment of the patient with leukemia. Modality ya kwanza tutakayotumia ni chemotherapy. This is the major form of treatment for leukemia. This drug treatment uses chemical to kill the leukemic cells, and the types vary with the types of leukemias. The type of drug to be given varies depending on the type of leukemia and the level of leukemia involvement. Depending on the type of leukemia you have, you might receive a single drug or a combination of drugs. These drugs might come in a pill form or they might be injected directly into the vein. Ingine tunaweza tukatumia systemic chemotherapy, aiming to eradicate the leukemic cells and induce the remission. In remission here we means that the bone marrow is free to produce normally occurring cells in the normal proportion without production of the immature white blood cells. Galena's chemotherapy is often divided into 4 stages. Stage ya kwanza ya chemotherapy ni induction stage, post-induction phase, and post-remission and maintenance phase. Hapo tunaigawa. Unaanza induction, unaanza matibabu na induced treatment, una move from induction stage to the post-induction stage, and then post-remission na maintenance dose. Drug therapy regime. The therapeutic agents used to treat leukemia varies. The combination therapy is the mainstay of treatment for leukemia. The 3 purposes for using multi-drugs are: kwanza, aiming to decrease the drug resistance with the single drug, minimize the drug toxicities to the patient by using multiple drugs with the varying toxicities. Lengo lingine ni interrupting the cell growth at the multiple point in the cell cycle. Matibabu mengine tunaweza tukafanya ni bone marrow transplant, BMT. Sometimes used to treat leukemia. Preparation for BMT, bone marrow transplant, include high-dose chemotherapy. You start with a high-dose chemotherapy, or a total body irradiation. The goal here is to destroy all the patient's malignant bone marrows, and then at the last possible moment, replace it with a donor's clean and healthier bone marrows. Allogenic transplant, we call it. You replace the patient bone marrows with a donor's clean and healthier bone marrows. Another type of bone marrow transplantation is known as autologous transplant. Hapa tunatumia patient-owned disease bone marrow, which is harvested, chemically treated and cleaned and stored, and later can be reinfused to the same patient. The transplanted bone marrow is given to the patient like a blood transfusion. Remember this. Generally through a central line placed in the chest. Once infused, into the bloodstream, the new marrows travel to the bones, where ideally it will begin to grow and function normally. Hizo ni modalities ambazo tunaweza tukazitumia katika ku manage hawa wagonjwa wenye leukemias. Lakini what are the specific nursing management to the patient with leukemia? Sisi kama profession yetu tutafanya nini juu ya huyu mgonjwa? Hayo madawa tumeona na mengine yote tumeyaona. Sisi kama wauguzi, moja tutakachofanya ni administration of pain relieving drugs, informing the patient, the physician, if the pain is not relieved, placing pillow behind the back, knees and other areas that require support and make patient more comfortable. Offer small frequent feeding of a blunt food which reduce oral irritation. Give frequent sips of cool to cold water to maintain fluid and nutritional levels. Maintain fluid balance by measuring intake and output, administering antiemetics. Hii tunampa kwa sababu tunataka to control nausea and vomiting. Monitoring vital signs, assisting the client with self-care as some patients experience fatigue. Give meticulous oral care because ulceration of the oral mucosa membrane may occur as a result of chemotherapy. Observe the client for signs of electrolyte imbalance and dehydration. Then, ukiona kuna dalili kama hizo, basi umpe huduma ile inayotakiwa. Replace the lost electrolyte. Isolation of the patient is very crucial, kwa sababu severe drop of white blood cells count is observed ili asipate maambukizi. Encourage the emotional support if necessary during painful or uncomfortable procedure. Advise the patient to wear a cape in case of alopecias kwa sababu ya side effect ya chemotherapy as a result of toxic effect of chemotherapy. Key points. Dear learners, leukemia is the cancer of the blood cells. The signs and symptoms include fever, night sweat, headache, bruising easily, bleeding, bone marrow and joint pain, a swollen or a painful belly from an enlarged spleen, swollen lymph nodes in the armpit, neck, groin, and the abnormal tired feeling and the loss of appetite. Thank you very much for your attention. I wish you all the best.